Sensitivity testing is a vital part of your clinical workup, and what this information is going to allow me to see is what your immune system has decided to attack. So whether that's a food, whether it's a chemical, whether it's some type of metal or a food additive, these are things that you need to know about. As long as you're continuing to react to these things, you're not going to get healthy. You're not going to be able to optimize your health. So we need to be able to remove these things, and we need to find out where the sources of these are coming from, and this testing is going to answer that for me. It's going to allow me to provide that information for you and tell you exactly where to start removing these interferences with your health from your environment. Now, the first thing that I want to go over with you in the process of the sensitivity testing, also known as ELISA ACT testing, is looking at the requisition form. On this requisition form, we're going to have everything filled out for you. The one thing that you will need to ensure that takes place is that on the highlighted area here, we do need to know the phlebotomist and the date and just have them initial that so that the lab can keep track of that information should they need to go back and look at a sample with the draw site. Now, in addition to that, the next thing you're going to do is you're going to take the instruction guide here. Now, please understand that you have to follow very specific instructions to complete this test, and if you don't follow those instructions, we're not going to have a valid sample, and the lab will not run the sample, and you'll end up going back and having to have the lab drawn again. The completion of this test is going to take place at a draw center. If you're local to the office here, we have some areas that are contracted that you can go directly to. If you're not local to my office, you're going to have to find an area, a draw site in your region. My office staff can help you with that. Now, let me go through and be specific on the things that we're going to have to, or that you're going to have to avoid to have a good sample here. The first of these is that, and this is going to be over a couple of days, so 4 days out, if you're doing any type of steroid creams, then you're going to have to avoid those steroid creams before, or for 4 days out before the testing. Otherwise, that interferes with the activity of the cells, and we won't get a good sample for you. If you're doing, or if you have done a cortisone injection, say you've got some joint pain and you recently had an injection into a joint, it's going to be a longer time frame before you can do any type of testing. We're looking at about 2 weeks there before testing can be completed. And also, if you're doing any type of medication specifically to address your autoimmune condition, Enbrel, as an example, Humira, these types of medications, you're going to need to, under the guidance or direction of your prescribing practitioner, stop those medications for 4 days before the testing is completed. Now, that's 4 days. At 2 days out, you're going to need to stop a couple of medications, things such as antihistamines, pain relievers such as aspirin, over-the-counter type medications is what we're going to be talking about. In this booklet, you're going to open that up. You'll see the items you need to avoid for 4 days out, and then you'll see the items that you need to avoid for 2 days out. Now, when you come over to the next page over here, there's going to be several items or several points that you need to take into consideration 12 hours before you're doing the testing. One of the things that we want to make sure of is that you don't have any exposure on your body or anything that's going to cause an abnormal immune response that would skew the results of this test. It's very important that you follow these collection procedures or these preparation procedures before collection to make sure that what we talk about in that consultation is exactly allowing me to give you exactly what you need to avoid and not telling you things that you don't need to avoid. This test is very sensitive. We want to make sure that it's picking up accurate information. Again, if these instructions aren't followed, they will reject the sample and it will result in you having to retake the test again. Now, you can follow those, you can read through those. Very specifically on the day that you do the test, make sure that you don't brush your teeth that morning. Make sure that you haven't eaten breakfast and that you're fasting. You can drink water, and it is always good to stay hydrated before a blood test. It makes the blood draw easier. And make sure that you don't brush your teeth. So you have to avoid those things to make sure there's no contamination of any type of test results. Now, there's also a couple of do's on here. You can rinse your mouth with spring water or some type of distilled water, and again, make sure that you do drink plenty of water. But you can go back and you can reference that information. Once the test is drawn, The next thing you're going to need is to make sure that this cooler bag that you take with you has been refrigerated. Now, it is important to differentiate between refrigerated and freezer. Don't freeze this. There's actually specific instructions on the cooler bag here that say do not freeze. Make sure you don't freeze it. Just place it in the refrigerator and it'll be fine. In the box that comes with this, you're going to take the freezer pack. The phlebotomist, the person that drew the blood, will put those blood vials in the box, and the freezer or the refrigerated pack will go in with that. You'll put it back into this box, and then this box with the paperwork that we talked about that we had that was filled out for you at the office will go into this UPS bag. In this UPS bag, you're going to, once it's in here, you have two options. You can call UPS to come get this, or you have the option of taking it to a UPS drop-off center, and either way it's going to get to the lab. It has to be overnighted to the lab to also have a viable sample. So this is looking at your sensitivities, and this is specifically going to tell me what your immune system is reacting to, which foods you need to pull out, which kind of toxins you're being chronically exposed to and probably have built up in your body that we need to work to clear your body of, and also what type of additives or environmental triggers you're being exposed to that are creating the symptoms that you're currently having.